Kia ora. These are the human rights issues that we experience as queer, trans and intersex people because of our sexual orientation, gender identity or our sex.
Respect intersex bodies. New Zealand infants born with an intersex condition are still operated on to make their bodies look more typically male or female. These treatments have severe sexual and reproductive health risks and are often performed without consent. Our recommendations are: legally prohibit surgeries aimed solely at correcting genital ambiguity on children who are unable to consent. Bring intersex people, government agencies and health professionals together to develop better medical practices in order to respond respectfully to intersex conditions.
I am who I am. It is still very hard for trans and intersex people to change the sex details on our birth certificates. We have to write legal affidavits and apply to the family court. Trans people have to show medical evidence of gender reassignment steps taken. This means that we may have to have hormone treatment or surgeries that may result in sterilisation. This breaches human rights standards and the advice of the World Professional Association for Transgender Health. We recommend follow the lead of countries like Malta and Argentina. Change the law so that trans and intersex people can change the sex details on their birth certificate based on their identity with no medical steps required.
Count us. Despite years of lobbying by our communities, neither the New Zealand Census nor the New Zealand Health Survey collect sexual orientation or gender identity data. Also, intersex and gender non-conforming people are invisible in sex data that only has two options, male and female. We recommend Statistics New Zealand and other government agencies should collect sexual orientation, gender identity and more inclusive sex data and consult our communities on ways to do this.
Make schools safe for us. We recommend that you support and fund sexuality education in schools that promotes diversity and tackles bullying and isolation of queer, trans and intersex students.
We have health needs, but being trans is not an illness. Gender diversity is still pathologised, which means my identity is treated like a medical problem. This is at odds with current international guidelines and practice. New Zealand does not have gender clinics. Recently, the only New Zealand public hospital that had been providing chest surgery for trans men announced that it would stop this service. Our recommendations are: ensure trans people have access through the public system to hormone treatment, surgeries, and other gender reassignment services. Provide sufficient public funding so that gender reassignment surgeries not provided through the New Zealand public health system can be accessed overseas or privately in New Zealand.
Protect us from discrimination at work. Trans workers face higher levels of discrimination trying to get and keep a job. We recommend explicitly add gender identity as a ground for unlawful discrimination in the Human Rights Act.
Include us in health action plans. Queer, trans and intersex people have much poorer mental health outcomes and are at higher risk of suicide than other New Zealanders. But the government's most recent Suicide Prevention Action Plan does not mention our communities.